Hello. I am very pleased to present to you the Circular Health Initiative, which is powered by the One Health Center of Excellence at the University of Florida, together with a group of very brave scientists from all over the world who have self-aggregated themselves into what we have called the e-yellow submarine. This little submarine, which is full of enthusiastic scientists, wants to break the barriers that there are between disciplines and wants to empower us to look at health in a different way. So the objective of circular health is to see health as a system. What we need to do and what we firmly believe in is that we need to co-advance the health of humans, animals, plants, and the environment. To do this, we need a circular approach. And we can develop this circular approach in a way that it can dovetail or meet the 17 United Nations Sustainable Development Goals. The Circular Health Initiative has two main objectives. The first one is to create an open network of international research focusing on co-advancing the health of humans, animals, plants, and the environment. We will achieve this by exploring new data-driven approaches to sustainable research through an existing circular health network. A longer-term goal is that to empower a community of international scholars who will be immersed in a radical interdisciplinary experience, which pivots around data and artificial intelligence and is geared to seek novel avenues that point towards sustainability. At the basis of our initiative is a radical interdisciplinary experience. And if we look at how we have addressed interdisciplinarity in biomedicine, we immediately recognize the One Health concept, which was developed in the 60s to define those areas of overlap between human health, animal health, and environmental health. But today, with big data and with the billions of devices that are measuring everything we do, we can actually push ourselves to be a bit more interdisciplinary and expand our behavior from what I would define a patchy interdisciplinary approach to what I think we need, which is a systemic interdisciplinary approach. And how can we do this? We can do this by exploiting the evolving present. The evolving present is now open science. Open access information is everywhere, and what it does is it actually makes disciplines more and more transparent. And once disciplines and areas of knowledge become more and more transparent, we can use them in a different way. We can actually stop looking at them as silos and start looking at them as if they were made of glass. And if we are brave enough, we can actually rethink at ways which we can generate new interdisciplinary approaches, particularly around health. The future, we believe, is that of a circular approach to health, which brings us to our initiative today. What do we need to seek convergence about? We need to seek convergence about data, because we, as I said, we are generating an unprecedented amount of data. And the current pandemic is certainly the most measured event in human history. But do we only have to measure and do we only have to compare variables that are linked to the biomedical environment? Here is where I think that we need to change. We need to be inspired by how people 2,500 years ago before us had identified health. Health is strictly interdependent from what is happening to earth, what is happening to water, what is happening to air, and what is happening to fire. If you look at these elements with the glasses of 2021, actually you can see how the ancients were really talking about transmissible diseases, zoonotic diseases, foodborne infection, respiratory diseases, air traffic, and of course, climate change, global warming, and fires that are burning and polluting our environment. What do we need to do today? Today, we need to look at this integrated perspective in a different way. We need to look at it using data, and we need to join up the dots to look at the bigger picture. The Yellow Submarine team became an accelerator of convergence, and we identified 7 areas in which we want to explore interdisciplinary research with reference to a broader way of looking at health. And so we developed this large network, which is based on a central hub, which is in Switzerland. It is hosted by CERN in its open access platform, the Zenodo platform. And we have a series of hubs that you can see here. One is what we call green. It's about citizen empowerment and environmental resilience. We have one on agro-food, which is about next generation quality for our food and how we can build in new standards of quality into a food that is actually good for you. And we have another hub on the social and behavioral aspects that we need to learn about and investigate, also following, of course, the emergence of COVID-19. And we have a hub on biomedicine in which we look at several aspects, including comorbidities, gender aspects, maternal and child health, antimicrobial resistance, and some of the veterinary aspects. We are also working on a hub on governance, which is working on 2 parallel row projects, one on developing a system for data for good, for donating data for health, and another one on developing a framework for governing an open research system like the one that Circular Health represents. And with this, I would like to thank you for your time, and please feel free to reach out to us if you are interested in joining this initiative. Thank you very much.